The truth behind supplements. Hi, I'm Hala, founder of Dietapplements. Today, I want to dive into something that confused me big time when I first started my journey in the supplement industry. Authorized versus non-authorized claims. Trust me, even a year into working with supplements, I had no idea what that meant. I was totally clueless. I know it wasn't the best start for me as a business owner. So today, let's dive into this topic together and figure out why it actually matters for you as a consumer, the difference between authorized and non-authorized health claims for supplements. First off, props to the UK regulators and brand owners. In all my time in this country, maybe 15 years, I've never seen a supplement label that claims to cure, heal, or treat anything, especially something as serious as cancer, because someone would go behind bars for that. So, well done to everyone keeping things honest and safe. But here's a catch. What about those non-authorized claims? Non-authorized health claims are a whole different ballgame. They are not about curing or treating. They are softer, more subtle, but not all claims are created equal. So let's break this down. Authorized health claims are legit. They are verified by solid scientific evidence and meet strict guidelines to ensure that they are not misleading to consumers. For example, our joints and bones formula states that it supports normal bones with vitamin C, D, vitamin K, and manganese, and zinc. This is an authorized claim, meaning that there is proper science backing the claim. It has been reviewed and approved by relevant authorities, enough for the regulators to give it the green light. On the flip side, non-authorized claims might lack the scientific evidence needs to back them up. I'll drop the EU Register of Health Claims link in the description below for you to check it out. Now, I can hear you asking, who decides what's what? Who decides if a claim is authorized? Who gets a say if vitamin D helps support your immune system or not? It's the EFSA, the European Food Safety Authority, the gatekeepers of health claims, I call them. If you're wondering who are those people, let me tell you what they say about themselves on their website. An agency of the European Union set up in 2002 to serve as an impartial source of scientific advice to risk managers and to communicate on risks associated with the food chain. Just for you to know, dietary supplements are considered food by law in the UK. Basically, they are the science geeks who make sure supplements health claims aren't nonsense. They are a friend, not a foe. Sure, there is plenty of bureaucracy. What big organization doesn't have that? But their work is grounded in science indeed. Here is one tip for you as a consumer. Do your research. Always verify health claims before buying a new supplement. Check out the EFSA website, link in the description below. I know it can be a hassle, but realistically, you only need to do it once and not juggle a bunch of supplements without knowing what's really in there. Now, you might be wondering, do we at Dietapplements love authorized health claims? Well, no, not exactly. Naughty, I know. Stick around for the next video to find out why.